Good evening, this is ABC News with Selena Ross. A Hobart man has spoken out about his desperate bid to get mental health treatment at the Royal Hobart Hospital. After attempting to get psychiatric care at the Royal twice in a fortnight, but only getting as far as the emergency department, the man took drastic action. Here's state political reporter Rihanna Whitson.
In July, Seth's mental health state was spiralling.
It was there, bashing him in the head, saying, "Kill yourself." And I knew I could. And I was in such a state.
In an act of desperation, he cut off his finger.
I didn't want to do it, but in the end, it was a choice between physically debilitating myself or completing suicide.
He was taken to the Royal Hobart Hospital in an ambulance. He stayed there for 2 weeks, where he was treated for his injury before receiving the mental health care he desperately needed. In the fortnight before cutting off his finger, Seth says he twice tried to seek help at the Royal.
You get help if you're in crisis, but only the right kind of crisis. If it doesn't look like you're bleeding to death, you know, coming into hospital, you're shunted to the side.
The first time, Seth says he left after waiting for 12 hours in ED. And the second time, he was discharged by a junior clinician after waiting for 8 hours in emergency.
If I'd been helped in those first 2 visits at hospital, I wouldn't have had to have come to that, a rational decision.
Since 2013, 10 acute mental health beds have been cut from the Royal Hobart Hospital under both Labor and Liberal governments. Last month, psychiatric patients forced to wait for long periods used towels and blankets for makeshift beds. Doctors have consistently been calling for the number of acute beds to be restored.
And a lot of patients, I think, are suffering because of this reduction in bed numbers that we have now.
We have to be looking at both the community sector and funding those services in people's home community to keep them away from hospital. But we need to make sure that if people get to that crisis point, that we have a hospital system that will support them.
In a statement, a spokesman for the Health Minister said he was aware of Seth's story and that the government was focused on reducing suicide with initiatives such as the Early Intervention Referral Service and additional resources for community organisations. The government says it has a $95 million plan to build a better mental health system, including 25 new subacute mental health beds. It's unclear, though, when all of those beds will be delivered. Rihanna Whitson, ABC News.
And if you or anyone you know needs help, contact Beyond Blue or Lifeline. A plan